Hello and welcome to this presentation which will discuss the pharmacodynamics and the pharmacokinetic properties of linezolid, also branded as Zyvox. In particular, this presentation focuses on linezolid's class, indications, methods, and key considerations for use. Oxazolidinones are mainly used to treat skin and soft tissue infections. Specifically, they are used against gram-positive bacteria. Linezolid is specifically used to treat pneumonia as well as skin infections. This can include the following indications: methicillin-resistant Staphylococcus aureus, methicillin-resistant coagulase negative Staphylococcus, vancomycin-resistant Enterococcus, and penicillin-resistant strains of Streptococcus pneumoniae. Linezolid should be reserved for infections caused by multi-drug-resistant bacteria. Linezolid is given to resistant bacteria because it is proven to work faster and leave less side effects when dealing with soft skin tissue. The mechanism of action of linezolid is the same as all oxazolidinones. It works by the synthetic antibacterial agents acting as a protein synthesis inhibitor on the ribosomal 50S subunit of bacteria. This then prevents the creation of the 70S initiation complex, which is a necessity to the reproduction of bacteria in the body. Linezolid is available in tablet form, granules for oral suspension, and can also be made into a solution for an injection. The absorption of linezolid is extensively absorbed after oral dosing. Maximum plasma concentrations are attained approximately 1 to 2 hours after dosing. The absolute bioavailability is approximately 100%. This means that linezolid may be given orally or intravenously without any dose adjustment. The distribution of linezolid through animal and human pharmacokinetic studies has been demonstrated to distribute to well-perfused tissues. The plasma binding of linezolid is approximately 31% and is concentration independent, and the volume distribution of linezolid is at a steady state average to around 40 to 50 liters in healthy adult volunteers. The metabolization of linezolid is primarily metabolized to two inactive metabolites, an aminoethoxyacetic acid metabolite and a hydroxyethyl glycine metabolite, both of which are a result of a morpholin ring oxidation. The elimination is estimated to be between 5 to 7 hours. Total clearance of linezolid is estimated to be 100 to 200 milliliters per minute, the majority of which appears to be non-renal. Some physiological effects, otherwise known as adverse effects, that happen to the body when this drug is ingested are diarrhea, nausea, vomiting, abdominal pain, taste disturbance, raised hepatic enzymes, candidiasis, myelosuppression, headache. Some clinical considerations to remember about linezolid are that prolonged use may result in fungal or bacterial infection, including Cdad, and this can occur greater than 2 months post-antibiotic treatment. Bone marrow suppression and peripheral neuropathy can occur in patients taking linezolid for longer than 14 days. So that means as a clinician it is important to have hematological and neurological monitoring throughout care to avoid linezolid toxicity. Clinical studies recommend that patients with uncontrolled hypertension or those who are pregnant should not be prescribed linezolid. Limited human data has found that linezolid appears in breast milk. Patients who are taking linezolid should be careful to avoid foods rich in tyramine, for example, mature cheese, soy sauce, and yeast extracts. This drug can also increase a patient's blood pressure. If the patient has symptoms of tingling or altered sensation, blurred vision, or difficulty seeing, they should seek medical help immediately. If a patient is taking any drugs for antidepressants, such as MAO inhibitors, SSRIs, SNRIs, they should avoid use of linezolid because they are at risk for serotonin syndrome. The scheduling of linezolid falls under Schedule 4, prescription drugs. It can be prescribed by medical practitioners, nursing practitioners, and midwives. The overall efficacy of this drug's clinical cure rate was 74%, and the bacteriological eradication rate was 69%. Now let's test your knowledge. Which of the following foods cannot be eaten by someone on linezolid? A. Chocolate. B. Vegemite. C. Bread. The answer is B, Vegemite. Which ribosome does linezolid prevent from forming? A, 70S, B, 23S, C, 40S, D, 50S. The answer is A, 70S. Thank you for watching my presentation.